Welcome everyone to our IAQM webinar today, Indoor Air Quality from Challenges to Practical Solutions. Today, as you can see, we're joined by Leonard Carey, who is the co-founder of DampSmart. Leonard has a master's in computer science and has spent over 30 years working in data analytics and mobile communications. He's developed technology and data analytics in conjunction with universities that is helping councils, building managers, health advisors and charities find new ways to understand and tackle indoor air quality, heat, ventilation and insulation problems in homes. As you're probably aware, today's webinar will explore the core challenges that Leonard came across in indoor air quality monitoring while working with Leeds City Council Public Health, University of Leeds and Green Doctors, and try and start a bit of a discussion on how to collaborate to solve some of them. So as always, there will be the chance for questions at the end of the presentation. So please do submit these in the Q&A option at the bottom of your screen at any point during the presentation. And then at the end, I'll ask them all on your behalf. So thank you all for logging in. I'll now hand over to Leonard for the presentation.
Thanks, Amy. Hi, everyone. It's a bit discombobulating. I can't see anybody, but hopefully you can hear me. And let's dive in. So my name is Leonard Carey, and as Amy said, I'm the co-founder of DampSmart. Our organisation is called Aware Technologies, and for a long time now, what I've been trying to do is how do we find a way to take technology, electronics, the Internet of Things, data, not just to provide lots of new graphs about what's going on in homes, but actually just to help people understand what's exactly going on in the property so that they can make better informed decisions. And part of that is about making sure that we're working with the right people. Probably heard that before from lots of other people like me, but we like to think that we took a slightly different approach. I've got to do a big shout out for Green Doctor, because none of this stuff, none of this technology, none of this analytics, none of this working out what's the best for houses could actually work without the help of people on the ground. And Green Doctor, particularly Green Doctor Yorkshire, you may have come across them. They've been absolutely fantastic because they're the people who are going into homes and armed with the data, validating the data with the residents as well. So we can actually start to see, what we see in the data is actually see what we see in reality as well. But more than that, they're actually helping people as well get over some of the issues that they're facing every day. I'll talk a bit about Leeds University as well. Did a great job at doing something quite extraordinary, really. We had an idea of trying to make the technology super small, really easy to install, because a lot of the time people just don't like lots of technology in their houses, big machines whirring away. And they managed to put together a really good piece of technology using Sensorion sensors and some other peripherals that we put together. But we've made it super small. And that was really good, because as part of this whole study, we wanted to get as much data as we possibly could from as many people as we could, but to be really high quality data as well. And we needed to make sure that people wanted to take part. We needed to make sure that we could get data from every single part of the home. We need to make sure that there wasn't going to be gaps in data. And one of the things that we experimented with was, how do we get sensors in a property that maybe have intervals of sampling of, say, 15 minutes, half an hour, and what the differences would be. We actually went for 5 minutes, and there's a really good reason for that, because we really wanted to understand exactly when something happened, so we can then correlate it with what's going on with the rest of the house. For instance, just spraying deodorant was really we wanted to pick that up. We wanted to pick up the spraying of the deodorant, but then actually seeing how it decays over time, but looking at it at very, very small timescales. So that when we then looked at other metrics that we were taking, like vapor pressures in the property, the ventilation, what was going on the and the heating as well, we could then see exactly when certain events happened. Like I said at the beginning, a lot of our motivation was all about outcomes. Is making sure that once we've got all this data, that we can actually deliver a good outcome for people. We can find a way of communicating what we discovered in a way that people could understand, but also they could take action, and others could take action. Other charities, the council, the landlord could see, all right, I get it. That sort of penny drop moment, that moment that says, all right, now I get it, and then take some action. There's a few anecdotal stories along the way, but we had residents who were really, really truthful. When we saw massive spikes in PM2 and volatile organic compounds, they said, "Yeah, I smoke and I light candles just to hide the smell, and yeah, maybe I'll try doing something different." And that was really great. It was good to have volunteers who were able to be able to say, "Yeah, this is actually what's happened." So we could then, if you like, mark the data. We worked with, I think you may be on this call, but we worked with Chris from Arc Airtech as well, because they've got a device that basically kills the mold in the air. And what we wanted to do is understand that if we were able to discover poor air quality, if we introduced something into the property that improved the air quality, would we see a difference in our indoor air quality monitoring and all the um, other algorithms and calculations that we came up with? And that was really good. And hopefully Chris will be able to say a few words at the end of this presentation, because there was some really good findings coming out of that. So indoor air pollution, I'm not going to talk about the effects of PM2, PM1, PM4, and PM10. Our focus was more about, can we classify things? Can we classify the spraying of an oil dispenser? Can we classify deodorant? Can we classify bleach, paint, um, anything coming out of furniture? And that's a really hard thing to do. And one thing that we discovered is that there isn't any real classification out there, and we set ourselves a hard task. How are we gonna do this? I can safely say we haven't solved it, but we're kind of now got the things in place where we can start to ask more precise questions to actually start classifying. Yes, we can tell when the log burner has been put on. Yes, we can tell when the oven has been switched on and maybe hasn't been cleaned for a while, and there's carbon inside the oven. Yes, we can tell whether the air fryer, the air fryer has been on as well. We had one case where we didn't actually detect we didn't actually detect any asbestos or anything. But I think by the mere fact that we were measuring what was going on the indoor air quality, the landlord of this care home brought forward their plans to renovate and make sure they can get rid of any outstanding asbestos. That was a bit of a side result of what we were doing, but what we were trying to understand is if we could see that there were a lot of candles, there was gas, there was oil. What we wanted to find out, I'll come back to this in a minute. What we wanted to find out is, what does this all mean? Now, a lot of you are probably involved in indoor air quality metrics and monitoring and analysis, but we were quite new to it. We've been doing a lot around understanding, I'm going to use, understanding how damp and mold and ventilation and insulation all interact together to create healthy homes. So we're very used to looking at how do we calculate the ventilation rates and all that sort of good stuff. But with VOCs and volatile organic compounds and particulate matter, we were quite novice. We were quite new to it. Where we thought, well, actually, it's very similar to what we're doing. It's one of the guys on the team. He's electronics engineer, and he looked at the problem as a digital signal processing. Now, just doing cross correlation and seeing how one thing works is correlated to another, and yeah, just trying different ways of looking at the data. But one thing that stuck out, particularly around VOC, was there wasn't any standards. And what you're seeing on the screen now is an excerpt from an email between the group, Leeds City Council, ourselves, Green Doctor, and Arc Airtech, where we were saying, guys, does anybody know what the standards are? What does it really mean when I get these big spikes? So when we looked at the VOC, we understood that there was, I'll go back a bit, we understood that there was this idea of an index. And typically, when at values below 100, then it seemed to be good air. After 100, it starts climbing and gets up to peaks out at 500, then comes back down the other side, get back to 100, and then what you're trying to measure is how long it takes for that decay to come back down. So, is this a long period of time? Does the volatile organic compound linger for a while? Is this a dangerous period of time? There aren't any standards on it. Not that we're aware anyway. Hopefully there are some soon, but not that we're aware. And the same thing goes for particulate matter. We looked up what the World Health Organization said about PM 2.5. And PM 2.5 seems to be the measure that most people go to say, well, actually, if you got particulates, mold, dust, pollen, it's around that sort of parts per million or micrograms, and that's if you like, the dangerous particulates. But the bar was really low at 15. I think it's about 15 micrograms, but there wasn't anything in the guidance to say for how long. And there's some around saying if it's for a long period of time over a matter of days. But we were seeing some really big spikes and long durations. We just thought, well, this can't be right. But again, it's something that we're still trying to find out what is good. What does good really look like? Because as you may see on this chart, the actual good line, the dotted orange line, is really low down. And most of the PM 2.5 is really, really high. And when we started breaking that down into something that, some of you may recognize, looking at a matrix of data. So looking at a matrix of data over days and also hours as well, trying to pick out where those big spikes came from. And it was really interesting when we did this, because quite clearly we had a sample set of, I think we had 6 homes. Quite clearly you could see those homes where they had maybe children who would go to school and then they come back, they'd cook dinner for the children. There'll be some people who would be at home all day, and you could see there'll be some spikes in lunchtime and so on. But what we weren't prepared for was some of the really big readings. And what we started to look at is, well, why are those PM 2.5 readings? Should we just look at them in isolation, or should we look at other things? Should we look at, is there a correlation with the volatile organic compounds? Should we look at the natural ventilation? I think on this particular one, or maybe another one later, we had a situation where it was a ground floor flat. The couple in there were over 60. They didn't really want to open their windows to ventilate the property because they believe it's a security risk. And so what you could see was the pressure in the house building up, the particulate matter going up as well. But what we tried to get them to do just for a couple of days is, hey, let's just open a window just for a short period of time. Let's see how we can reduce that pressure in the property. And yet, could we see a reduction in the indoor air quality, an improvement in the indoor air quality and reduction in PM 2.5? They're really reluctant to do that. And you can understand why. Because for them, it was a bit of a security issue. And this is where it comes, the part about taking data and applying it in the real world starts to make sense. Sometimes you see some really, really difficult situations within the data, but to actually apply a change is going to be hard. I think if I just so here's one where most recent one, and it just as a reminder of how we can do some really good data analysis, but actually the hard bit is how to then get a good result. This one, the property as a young child, lots of mold around, as you can see from this one picture. The child had a history of respiratory conditions. We could see in the data indoor air quality was pretty poor. We could see in the data that the ventilation wasn't great either. We could see that when the fan was put on, it wasn't extracting enough. But also we could see that the heating just wasn't great either. But this one was interesting because this is where the Green Doctor guys were absolutely invaluable. The qualitative data behind that was, she got a manual storage heater, still paying by a top-up card. Manual storage heater wasn't very effective. And if you ever use a storage heater and it's in winter and you're home all day, you've got to be really good at charging up that heater overnight to make sure it's giving off enough heat during the day, and often it doesn't. And these are the things that we were discovering. The data was pretty bad, but it's the what do we do next bit. And I think that's the hard bit. That's the bit that we're trying to get more people involved in to help us solve. I'm just going to go back a couple of slides. One of the things that we're trying to do and getting more people involved is to make this really super simple. Yes, there's loads of indoor air quality devices out there. Yes, they've got displays on them and lots of amber and orange and amber and green and red lights on them. But what we found was that we wanted to be able to get the data, as much of data as possible, remotely, and make it really easy to collect. So one of the things that we did was, number one is get a hub device that has got a SIM card in it, super small, and we also have a whole bunch of temperature humidity sensors that we dot around the house. And that just all talks to one hub. But also working with Leeds University, we actually built an indoor air quality device that could talk to the hub as well, just using by Bluetooth. So all you needed to do with the hub, with the air quality device, was just plug it in, and it just went. And we wanted to do that and make it really small, so that we could put loads of them around the house as well. One of the things that we've discovered over the years, and we have experimented with around using 3D models, is once you can get time and space, once you understand where the sensors are and the elevation, so how high they are and which rooms they are in as well. And you get enough of those around the place, then you can do some really great stuff with predicting what's going on and diagnosing what's going on. But in order to do that, you've got to have really unobtrusive technology. You've got to have stuff that actually works and can transmit every 5 minutes or every minute if you wanted to. And what we discovered, there's a bit of a trial and error process to all of this. We just didn't come up with this overnight. We spent the last couple of years looking at this, but we looked at things like the LoRa networks to transmit the data. They're great, and don't get me wrong, but we just couldn't get it to be able to transmit at the frequencies that we wanted to and the data packet sizes that we needed. But also we were coming foul of the fair usage policy as well, because a lot of the LoRa networks, they do say that please don't overwhelm the network. So because of the high frequency we wanted, we went for GSM. We also, and it's quite surprising to us really, but the indoor air quality device, we were quite surprised there's very few, if you like, connectable indoor air quality devices. So we just made our own. Sounds as if really easy, and the guys at Leeds University would say, yeah, then you're downplaying it. But if any of you have ever done bit shifting and want to have a coffee and talk about that low-level stuff, just give me a call and we can talk forever about how we made those modules talk without any problems. I guess what I want to come back to this. We are really, really focused on making sure that all this data provides good outcomes for people. We're trying to find a way to make sure that the data that we create is easily understood. And then if any of you are user interface and user journey experts out there, then let's have a chat. Because we know that we can't solve this problem of what indoor air quality is and how bad it can be. We know we can't solve that link between, okay, so what do you do about it? What next? The what next bit does need a collaboration between the tenants, residents, homeowners, but also those people who are there, feet on the street, ready to help out. But it does need that understanding between all parties to say, if I see VOC at 495 index, what does that mean? Do we have the same understanding? Do we have the same understanding of what are the main sources? Is it the stuff I'm using, or is it the outdoor? We've had examples of where people live near to a main road. It's known for the high levels of pollution. They close their windows to try and stop the pollution from coming in. But then when they open them again, you can see the air quality just going, it's not very good. But what do you do about it? And that's the challenge that we're trying to address. So I guess in summary, we went on the road of trying to do some analysis that helped us deliver better actions. Everything was about outcomes. But in that journey, we discovered there's a whole bunch of things that we just didn't know. There's a whole bunch of things that just aren't in place, some standards that you'd have thought there'd be a clear explanation of what PM 2.5 you should be trying to achieve. We thought there'd be a clear explanation of VOCs. But when we looked at the data, we thought it just doesn't fit. This can't be what the standard is. So maybe there's an opportunity to create new standards through observation and classification. I think getting great volunteers on board who were willing to take part but also be honest and truthful about how they actually live their lives was invaluable. There is a bit of a challenge there because you don't want to overwhelm people with a long diary of, okay, tell me what you did at 3:15 p.m. So we experimented a lot with how do we go back with a summary of, look, we think something happened at this time. Do you remember what it was? So even doing that piece of design around interviewing people, that was hard. And we failed, we succeeded, but it's important to get it right. Time and space is really important to capture everything and to be able to say, yeah, if it's not that, then it must be this. And doing it everywhere at high frequency. I think, but in doing that, there comes the other part, which you don't really want to kit out somebody's house with lots of trailing wires and lots of stuff that makes them feel as if they're being watched. So there's a bit of a balance there. Inside and outside data, really important. You need to know, is it from the inside or is it from the out, and try and remove those causes. We look at indoor air quality as not just about particulate matter and volatile organic compounds. We look at it as from mould point of view, because it's horrendous in some of the properties that we go to, and it is the thing that needs to be fixed above everything else. But also in relation to that, there are, we calculate what the heating risks are. Is it underheated, overheated, or the ventilation and the insulation. Insulation particularly, because you've got cold walls, cold, wet walls, you're going to get mold. So we calculate, is the wall contributing to the issue? And then, like I said, at the end, the action is providing tailored advice and help. And that's where not just Green Doctor, but working with construction engineers now and housing managers, because I think everybody's starting to ask for that guidance, and they want to be part of a team that can deliver that guidance, but only deliver it if they understand it. So that's one of the challenges that we need to face in the next few months, is how are we going to turn all this PM VOC data into something that people feel confident about understanding, and so therefore they're then confident in providing advice and assistance. That's our challenge. We're inviting people to come along and be part of that journey. We want to do something bigger, but as you probably heard, it's not easy. And some of you have tried to do this. I know that the team, I think it's born in Bradford, they're really good. They helped us at the beginning just to understand some of the complexities that may be involved. But now we think we overcome some of them, or a lot of them. I think the time is right to actually start doing something a little bit bigger with new partners. So I'm going to end there and open it up for any questions, any observations, and thank you very much.
Great, thank you, Leonard. That was really interesting. I'm just gonna pop this down for a second. There we go. So I can see we've already got a few questions coming in, so I'll just go straight over to those. And obviously, if any more come up as we're talking, then attendees, please do feel free to ask. So the first one was regarding the high frequency data collection of 5 minutes. Were residents keeping corresponding diaries? I know you mentioned kind of asking them if they felt that spikes might have related to something they were doing, but were they keeping diaries? Were they kind of less formal than that? How did you use that information to correlate with their activities?
So we started off using diaries, but they were just too big, just unwieldy. People don't like it. So we then tried a different technique. So we looked at the big events. So we looked at the big spikes and the big durations. And we looked at, for the first week, we said, okay, here's the profile of the house. Here's what typically is happening in the house. So if we see it again next week, let's go back and say, hey, we see that on Monday mornings, this happens. Can you just tell us? So we kind of aggregated the data a bit more. So rather than it being a big long list of 5 minutes, I sprayed this, I did. It's very much we took the 5 minute intervals, but then we said, look, to make it easier for the homeowner, the resident, let's give them a general view of what typically happens at.
Someone asked something that does relate to that as well. So again, you kind of mentioned not wanting things to be too obtrusive, but have you had any residents or come across anyone who had any opposition to having this sort of monitoring equipment in their homes, despite knowing that they had issues with mold or damp or pollution? And if so, how did you get around it?
Um, I'm going to safely say we've had nobody say no. And I get kind of emotional around this. The reason I get emotional around, sorry, get emotional around is because we ask for consent all the time, and our absolute objective is to help people, nothing else. And we spent years making sure the technology is unobtrusive as well, so they don't see it. And we make sure that people who come round to, well, either we put it in the post and they do it themselves, or I go round, or one of the team goes round, or one of the green doctors, or someone who they trust goes round. And that's really, really, really important. If you don't have that trust, if you don't have a way of helping somebody out of this situation, then it's no point.
Yeah, absolutely. I think that's got to be at the core when you're doing it literally in people's homes as
Mm,
well, hasn't it? It's not collecting data for collecting data. It is collecting data to improve people's home environment. So
yeah.
that's really great to hear. Um, so another one on engaging with residents, I will go on to a different topic after this one, but did you find any challenges around residents' anxiety? Did the data make some people turn away from the project, or were people on board and
Yeah.
proactive once you told them what was going on?
This is a really, really good point. Um, um, Data has a habit. I don't know if you've got a Fitbit watch, Apple Watch, and steps and heart rate and all that sort of thing. There's always this danger that the data can make you more anxious. It may, yeah, make you more anxious. And so, we were putting together reports, and we've spent so many cycles of, okay, should we just have a one-page report that just says, great, tick in a box? Or let's send somebody around, or do we give them the full data set? I think we're still experimenting with that. And yeah, there are some houses that we've been in where it's not the right thing to provide them with all the data. It just simply make them more anxious. They're in a complex environment, complex situation. Really what they want is help rather than more data to confuse them. So it is a difficult one. Don't have the answer right now. We've got, as I said, we're going still, even now, we're going through iterations of what's the best thing to communicate. We're working with housing associations, councils, charities, everybody trying to get it right. Hey, we're on a journey, and it'd be great to talk to whoever had that question to see what their experience was as well.
Great, thank you. And just kind of on what you've just said, how have you found it working with all of those different stakeholders? Obviously, some of them having much more of a knowledge of air quality and maybe the health effects, or the kind of technical knowledge of air quality, right down to residents. How do you kind of balance those stakeholder relationships?
It's one of those we partnerships. Yeah, it's all the partnerships. Everybody who's come to the table has got the same desire to actually do good. Is make make sure that we're doing the right thing and that we're coming out with positive outcomes. Once you start with that, it's kind of easy. Um, You can have Gantt charts as much as you like and much as risk management as much as you like. But if you don't have a group of people who are absolutely lockstep in line with this is what our outcome is going to be, then it's just going to take up time. We've been lucky. We've been lucky to be working with Green Doctor and with our care tech and those guys, because the absolute goal is a singular goal, is how we're going to make those people's lives better. So working with stakeholders, yeah, there's been some stakeholders, if you say there's some landlords who have been a little bit difficult, because when it comes to, look, you need to change that heater or you need to do this, we're still trying to find the language for that. But other than that, stakeholders, it's all good.
Great, that's really good to hear. That's kind of how you hope it will play out, isn't it? But yeah, glad to hear it has actually gone that way. So someone's asked, in terms of the monitoring itself, how much, or do you have a way to kind of discern how much of the measured PM 2.5 is innocuous things such as water vapors? Is there any sort of correction factor in the monitoring, or was that even required?
Like I said before, we're not the experts in particulate matter. We went on a journey of, let's start this. Let's make it easy to collect the data and let's start analysing it. And whilst we're analysing it, we're going to come across things we have never seen before. So to answer the question, yeah, we don't even know whether there's a need to correct for water vapor. We deliberately, for instance, put some of the sensors near where we thought there would be a likely source of spikes in volatile organic compound and particulate matter, places like the bedroom where people sleeping at night, and that it was just sealed up, or in a kitchen, or in a living room where there's a log burning fire, or there's just a gas fire. So we deliberately put it in places where there would be some spikes, but we didn't put any correction for water vapor. But if there is some corrections that we can put in, that'd be great to have that conversation.
Great, thank you. Yeah, again, I'm more than happy to share your contact details when we share the recording of this. So
Yeah.
hopefully people will be able to get in touch with you if they would like to follow up. As we're sort of coming to the end now, I think we'll just go for one last question. So maybe this one. How did you go through the process of selecting suitable households to monitor? Was there anything in terms of medical conditions or special characteristics that helped you select those working with the other stakeholders, or was it kind of your decision where you were doing that?
So we worked a lot with Green Doctor on this because they see thousands of people every year. And in that group, there are, we try to have a selection of people who maybe had young children, those who are elderly, those in pre-1940s, I think they are the prefabricated places. So we try to spread it out a bit. Sample size wasn't great, wasn't big. But we took an approach of trying to find people in those sort of, if you like, cohorts. Another cohort was those who had mould or had history of mould in their properties as well. So we had a methodology of looking at and segmenting everything up, even looking at those with COPD and emphysema, and I've forgotten the other, but we looked at health conditions, age, type of property as well. So we tried to spread it. It's just that the sample size wasn't great, so we didn't always get exactly what we wanted.
Okay, great. That's interesting to hear. As I said, we're kind of coming towards the end now. So in lieu of another question, I just thought I'd share what one of the attendees has put in the Q&A, which is a nice note to end on. They've just said that it's inspiring to see how passionately you feel about your work. They're glad to see that indoor air quality is becoming a more prevalent topic within the sector. And it's really great to see that it's becoming more easily accessible and understood by the public, because obviously that's so important. And I'm sure a lot of people in this call today have kind of had similar reflections. So thank you again, Leonard, for the presentation.
It's a pleasure.
So as I said, that's it from us today. So thank you everyone for logging in and joining us. I hope you found that beneficial and informative. If you are watching this as a recording on YouTube, please do subscribe to the channel, like the video, and if you click on the bell icon, you'll be notified when we share new content. We're right at time now. Thank you again, Leonard, and thank you everyone for joining, and I hope you have a great rest of the day. Thank you.
Thank you.